Coyle and Latino Hispanic Engagement Manager Karina Gonzalez, who is available to answer your questions in Spanish. We'd like to remind you that when it's time for questions, please text me here to get in line. You'll be called on when it's your turn. Shortly after this media availability is over, the recorded video will be available at watch.mecnc.gov. That's the same place you watch the Board of Commissioners meetings, watch.mecnc.gov. Without further delay, here is Interim Public Health Director, Dr. Kim Scott. Dr. Scott.
Thank you. Good afternoon, everyone, and thank you for joining us for today's briefing. I'd like to first start by communicating some timely updates concerning measles to ensure public awareness and education for Mecklenburg County. So measles is a viral illness that can easily spread through the air. We know that measles is one of the most infectious diseases and spreads very easily when a sick person coughs or sneezes because it can stay in the air or on surfaces for up to 2 hours after leaving an area. Measles symptoms typically include fever, runny nose, rash, or red eyes. Measles can also have several severe complications like hospitalizations or pneumonia, especially amongst our young children and immunocompromised persons, which basically means a person whose body might not be able to fight infections like some others. Around 90%, or about 9 out of 10 unvaccinated individuals who are exposed to measles may become infected. So what we know currently, when thinking about Mecklenburg County, there have been 2 confirmed cases of measles. The first confirmed case is of an adult who was a confirmed case of a measles via travel. The adult with an unknown vaccination status is recovering in isolation, and contact investigation process is currently underway. The second case is an unvaccinated Mecklenburg County child who had been in contact with a child in South Carolina, where we know that there's currently a measles outbreak of over 600 cases that are ongoing. The child is recovering at home in isolation. The Mecklenburg County Public Health Department will continue to provide updates as needed with information on how to protect health and prevent further spread of disease in our community. Our case numbers will align with the State Department of Public Health and Human Services, which updates their measles dashboard twice a week on Tuesdays and Fridays. The cases are not linked to one another, and our responses continue to be structured, evidence-based, and rooted in public health practice and prevention. Before I turn it over to Joy Smith, who is our Communicable Disease Director, I just want to transition by saying that we know the most effective way to prevent the spread of measles is through the MMR vaccination, and we are currently promoting efforts to ensure that people are aware of how to get vaccinated. At this time, I will turn it over to Joy for updates from our Communicable Disease team.
Thank you, Dr. Scott. Hi, I'm Joy Smith, the Communicable Disease Director for Mecklenburg County Public Health. Our team is responsible for communicable disease investigation and contact tracing. Once we receive notice of a suspected or confirmed case, our communicable disease nurses conduct a thorough investigation to determine the individual's infectious period, travel history, and potential exposure locations. The individual is then advised to isolate to prevent further transmission. The next step is contact tracing and notification. Trained staff are notifying individuals who may have been exposed. Those contacts will receive guidance based on their risk level, including symptom monitoring, testing, vaccination recommendations, and quarantine if indicated. I would like to note that that process is complete for the adult who tested positive. We also assess immunity status of exposed individuals and provide post-exposure prophylaxis when appropriate. Those who are eligible for post-exposure prophylaxis should receive that within 72 hours. They also may be required to be monitored just out of an abundance of caution. If an individual is not available to be post-exposure prophylaxed and does not have record of immunity, they will enter a 21-day quarantine period. Again, as Dr. Scott has previously stated, MMR vaccine remains the most effective protection against measles. In the event of a larger public exposure with future cases where we can't identify or contact potential exposures, we will put out a public notice. And now I'll turn it over to our medical director, Dr. Bonnie Coyle.
Thank you, Joy. Good afternoon, everyone. I'm Bonnie Coyle. I am the Medical Director for Mecklenburg County Public Health. As you've already heard, measles is a highly contagious virus that can have serious complications. It is so contagious that you can get measles just by being in a room where a person with measles has been. This can happen even up to 2 hours after that person has left. There's no specific cure for measles. The treatment focuses on supportive care to relieve symptoms like fever, cough, and rash with rest, fluids, and over-the-counter pain relievers. Vaccination is the best tool we have to prevent measles and avoid serious health complications from the disease. Children should receive 2 doses of the MMR vaccine. The first dose is at ages 12 through 15 months of age, and the second dose is given between 4 and 6 years of age. 1 dose of the vaccine is 93% effective at preventing measles, and 2 doses are 97% effective at preventing the disease. For most adults, 1 vaccine is considered adequate coverage. Some groups, like healthcare workers, college students, those who are traveling internationally, and contacts to immunocompromised individuals, should receive 2 doses of MMR. In addition, adults who are born before 1957 are considered immune. If you're unsure of your vaccine status, talk with your primary care provider about whether you should receive additional doses or check a titer to see if you are immune. If you do develop symptoms of measles, call your doctor, clinic, or emergency department right away. It's important to call the healthcare facility before you go in order to get instructions so that we can prevent further spread of measles. Thank you, and we will now open it up for questions.
Floor is now open for questions. Please identify yourself and your media outlet. Otherwise, you can text me through the message function to get in line for questions. Thank you. First question. Do we have any questions today?
This is Michelle Crouch from North Carolina Health News and the Charlotte Ledger. I'm wondering if anyone is in quarantine, and if so, how many people?
So, Michelle, I think we are still in the middle of contact tracing for the second case, so I don't have that exact information. We could possibly get back to you with that.
Next question, please. Do we have any more questions today? Last call for questions. All right, thank you all very much today. Again, you can watch this recorded media availability at watch.mecnc.gov within the next hour. Thank you all for your attendance. Stand by. We have one question. Go ahead.
Sorry, me again with another question. So I know you said you finished the investigation of the adult, and I know you didn't publicly announce any exposure sites. Does that mean that you've been able to contact everybody that you believe was in contact with him, and there's no public site?
That is correct,
That is
based on our
correct.
investigation.
And what is the time frame for the investigation of the child's case? How long do you think that will take?
So that's going to depend on whether or not there are contacts identified that, then again, test positive or need to quarantine. We do expect to be working on this probably into next week.
Thank you.
Thank you for that. Next question. Last call for questions. I thank you all so much for your time. Again, you can watch this content within the hour at watch.mecnc.gov. Everybody be safe and have a good